Hello dear friends, this is a case of a 58-year-old female patient who presented with severe abdominal pain, mainly in the epigastrium, significant episodes of vomiting, forceful multiple episodes of vomiting, and CT scan was performed. I will scroll the images so you will make your impressions. I have put some arrows in some interesting points we will discuss later. Here is the esophagus. Here is some air in the liver. Here is the stomach. We can see a tiny gas in this point and at this point, representing some perigastric veins. So, in conclusion, here we have some gas in some perigastric veins here and there, and some gas in the liver, representing presence of gas in the portal venous system. Another interesting point is the esophagus shows some deformity of its wall, and there is strong evidence that there is mural injury. Another interesting finding is that there is regional fat stranding in the mesentery, and there are some prominent and moderately enlarged lymph nodes, mesenteric lymph nodes. So this is a case of chronic mesenteritis. Similar findings were found in the previous CT scan a few years back. Now, as for these findings, the combination of gas in the portal venous system gas in some perigastric veins and evidence of intramural gas in the lower esophagus with a history of multiple forceful vomiting episodes indicate Mallory-Weiss syndrome. I remind you that Mallory-Weiss syndrome should be differentiated and never confused with Boerhaave syndrome. Just a reminder that both Mallory-Weiss tear and Boerhaave syndrome are caused by sudden forceful vomiting or retching, but they differ drastically in severity. A Mallory-Weiss tear is a partial mucosal tear causing usually upper gastrointestinal bleeding, whereas Boerhaave syndrome is a full-thickness transmural esophageal rupture causing a life-threatening situation. Probably this case represents a chain reaction, probably started from mesenteritis with lymphadenopathy leading and resulting to multiple vomitings, and the forceful vomitings ended up and resulted to this condition, the partial tear of the lower esophagus, Mallory-Weiss syndrome, and all this gas traveled through the perigastric veins to the portal venous circulatory system. Dear friends, thank you for watching this interesting and unusual case. See you the next time.